Hi, I'm Madeline Sentek. I'm the ASA Monitor Multimedia Publication Specialist. And today we have a question and answer session with Dr. Zachary Deutch. Welcome, Dr. Deutch.
Thank you, Madeline.
To start off with, I'm going to ask you, what do you like best about being an ASA Monitor columnist for your column on Ask the Expert?
That's a good question. I like being able to reach all the members of the ASAs. I think it's over 50,000 people. So I feel like if I'm fortunate enough to have a message that I can send out that's effective and is useful to members, that I've really actually made a little bit of a difference. That's very, very rewarding. The staff, Dr. Schaefer, it's just been a really easy process. And so that alone just makes it kind of effortless. And I'm hoping that people are liking the material. And then by reaching a broad audience, we have a huge impact, and we can actually help people in their everyday lives, their decision making, or just their thirst for knowledge.
And how do you think your column brings different voices to the spotlight?
Great question. I specifically want to have people. We all know there's so many of us in this specialty and in this organization that are very skilled, but sometimes we hear the same faces, the same people. I want to bring out people that are experts that you may not know of, or that are younger, starting their careers. This is a great vehicle for that. I've been able, I think, to do that pretty successfully. So really my focus is to get a more broader range of people involved in the discussion, sharing expertise that we may not have, people that we haven't seen before, that again we may see in the future.
And what do you hope that readers take away from your column?
I'm hoping that every month what we have is something useful. And so whatever the topic is, if they're getting something clinically useful, something professionally useful, it's not supposed to be esoteric, it's not supposed to be generic. It's supposed to be something that like, ooh, I didn't think of that, or I'm glad someone else does the same thing that I do. It reinforces my practice and my sense of confidence in what I do. It's basically like here at the ASA, we might pass people in the hallway or at a committee meeting and ask them about a clinical situation or get a pearl from them. That's what I want people to pick up on the column.
And what is your personal mission with the column?
I'd like to say self-promotion, but that wouldn't be true. I'm just joking. My personal mission is, again, to enrich people. Like, I want, the ASA has a big push for the Monitor to make it really readable, to make it something useful for members, and I really want my contribution to be a big part of that. I want it to be something where people every other month are looking forward to reading it, and they say, hey, the Monitor is so much better, and this is one of the foundations of that, and this helps me with my practice or answers questions that I have.
And how has your role as a columnist helped you expand your expertise and helped bring different issues to the spotlight that anesthesiologists are facing?
That's a good question as well. I think some of the stuff, I've been in practice for a couple of decades, so, I think I'm a total hero and I know everything, and of course I don't. And so learning from people, other aspects of their practice is always helpful. But especially things like I think it was the very first column we did with Dr. Pisani about the COVID-19. I knew nothing of that because A, I'm not a critical care physician, and B, we weren't being hit with the same acuity of patients in our area. So that was totally an eye-opener for me to talk with her and to read what she wrote. So I learned from the column the same way that readers do, despite the fact, again, that I'm 2 decades into practice. I mean, I make mistakes, I make misjudgments, I have things that I'm unclear on. So I should gain from it, and I do gain from it the same way that any reader does.
Can you tell us more about the name of your column, Ask the Expert, and why everyone is maybe an expert?
I mean, everyone is an expert in their own way. So the idea is I want you to listen to the column. So if I say this person is an expert, that tells you, okay, this person is someone that is very knowledgeable, and it's worth my time. It's worth my 90 seconds or 2 minutes or however long it takes to read it. And that's the first part. So I want to draw you in. I want you to say, I'm going to get worthwhile information out of this column. The second thing is it doesn't just have to come from someone that has 7,000 peer-reviewed publications or someone that invented their own bypass machine. It could be someone that works down the hall from you that is unbelievably good at dealing with kids under the age of 4, for getting them off to sleep and doing it safely. That's an expert. They may not be celebrated on stage here, they may not be seen in the literature, but they're also people that we can count on to help enrich our practice. So everybody has an area of expertise. Everybody. It's just a question of what it is, and people oftentimes feel intimidated to bring that out or not comfortable, but I know from working in group practice, it is there.
Are there any articles that you particularly enjoyed writing that you'd like to draw readers' interest towards?
A lot of them have been good. All the columnists, co-columnists have done an excellent job, and I'm not just saying that, they really have. And they've all been nervous about, am I doing the right thing? Are these questions okay? I'm like, you tell me, I give you the questions. If you want to change it, we change it. They've gone right along with what we did. We've really had a plan. I think that the vision was the same. Honestly, the column that hasn't come out yet about environmental impact of perioperative medicine with Dr. Cheeseborough, that to me is a really good one because it's a personal interest of mine. I think that's one of the best ones we've done. They've all been good, but I think people will look forward to reading that. That one was excellent.
Well, it was great to talk with you today.
Thank you for having me. Appreciate it.